ESG, it's an exciting new procedure. It's the endoscopic sleeve gastroplasty. So it is a newer procedure. It's been around for a few years, but we've really finally gotten some really good data on this new procedure.
There's no incisions in the abdominal wall. It's done endoscopically. This consists in putting an endoscope, which is a camera that we introduce through the mouth, and look inside the stomach. And with a special device, we can suture the stomach and reduce its size. By reducing the size of the stomach, it reduces the quantity of food that people can eat, and also produces that sensation of fullness. And that combined with adequate lifestyle changes, including more exercises and healthy eating, could achieve weight loss. So the ESG is indicated for patients who are affected by obesity, who have excess weight, and usually is approved by the FDA for a BMI between 30 and 40. Those are patients that could have up to 100 pounds of excess weight in some cases.
It really is a procedure for those patients that, for whatever reason, surgery is not going to be their best option. Somebody who is a lower BMI who really doesn't meet the surgical criteria, or someone who doesn't really want to go through a surgical procedure. This is an endoscopic procedure that can give us close to surgical weight loss. And if we add medications, we can get very close to some of our surgical results with the endoscopic procedure. It's a very robust procedure that I think we can use for a lot of people.
It's an ambulatory procedure. Patients go home the same day. It's scarless, so there's no involved pain after the surgery. And usually my patients are back to work probably 2-3 days after the procedure.
Post-procedure, these patients will have a little bit of nausea, maybe some cramping the first day or two, but really, after 2 days, most of these patients say they feel back to normal.
Although the ESG is not covered by insurance, recently there was an article published in JAMA that compared the long-term cost of ESG versus using injectable medications for weight loss. As you know, the injectable medications are lifelong. The study revealed that the ESG is more expensive during the first year. They catch up at about 2-3 years, and then at 5 years, the cost of medications was $33,000 more expensive than the ESG.
We know where this procedure fits. If a patient comes to us and this is an inappropriate procedure, we can steer them to something that is more appropriate. We have everything. So if someone comes to see me and this is inappropriate for them, we're going to talk to them about what would be more appropriate. There are very few centers around the United States and around the Southeast that are doing this. And my advice is to seek out a practice that does not just the ESG, but also can offer the other procedures in case this really isn't the best option for you.
Lifestyle and dietary modifications are the cornerstone of any type of weight loss treatment. With the ESG, it's not as restrictive as it is with other, let's say, bariatric surgical procedures. Some malabsorptive procedures, such as the bypass, the duodenal switch, there are very specific dietary restrictions. With the ESG, they won't get those secondary symptoms if they eat certain type of foods, but we do recommend a high-protein diet, low carb, low fat, include exercises in their daily routines.
I always tell any of my patients that is looking for robust long-term weight loss that we don't have a procedure that lets them do what they're doing right now, lose weight and keep it off. All of our procedures require that a patient understand that we're going to help them make some lifestyle changes. So sometimes it's hard to make these diet changes on your own, but these procedures give us a little bit more help for making those dietary changes. So patients are going to meet with our dietitians, they're going to meet with me and our medical management staff, our nurse practitioners, and we're going to follow them very frequently for the first year to make sure that they can get this robust weight loss.